Hi, and welcome to the Skincarma Pod. I'm Carmine, the creator and voice of the Skincarma blog. With more than 25 years in beauty as a brand builder, copywriter, and skincare junkie, I'm putting my product wisdom and expertise to work demystifying skincare. On today's episode of the Skincarma Pod, I'm joined once again by Mark Broussard, an industry expert who sits at the exact intersection of cosmetic chemistry and regulatory compliance, two distinct disciplines at the heart of brand building. Mark is the founder and managing director of Bloom Cosmetic Test Lab, where he guides brands through MoCRA compliance. And if you caught our last episode together, I believe it was episode 45, you know that he's also the founder and master chemist of Desert in Bloom Cosmetics Lab, where he's developed more than 600 products over his career. With his extensive background spanning a number of disciplines, Mark is one of the beauty industry's most trusted voices on the Modernization of Cosmetics Regulation Act, better known as MoCRA. MoCRA represents the first major update to U.S. cosmetics law in over 80 years, leaving brands to navigate an entirely new regulatory landscape. Today, Mark and I will break down what every beauty executive, founder, and product developer needs to know right now, from facility and product registration to labeling, safety substantiation, adverse event reporting, and what MoCRA actually means for innovation moving forward. If you've been confused, overwhelmed, or just looking to keep up with the new federal requirements, this episode should be your blueprint. So let's get to it. Let's talk to Mark. Mark, hello.
Hey, how you doing today, Carmine?
Great. Welcome back to the Skincarma Pod.
Pleasure. I appreciate the offer. Thank you.
You're only the second person who's ever appeared twice.
My God. Thank you. I'm honored, Carmine.
Episode 45. I think this will probably be episode 56. I think it's 56. So 10 episodes apart.
From the first time.
Yeah, from the first time
Okay.
we spoke.
All right.
And if I remember correctly, we alluded to potentially talking about MoCRA, but we never got around to it because there was so much else going on. We talked about the 1% rule, right? Yeah.
Correct. Yeah. 1%
Yes.
rule and skin minimalism. Correct.
Yes, you really opened my eyes on that 1% rule. I've never stopped thinking about it. Every time I turn a carton around, I'm like, okay, I don't know what to believe here. Up to
Exactly.
phenoxyethanol.
Yep. And hope phenoxyethanol's in there. Otherwise, you don't have a really great
You're really lost.
demarker.
Oh my
Yes.
god. See, that's an argument for using phenoxyethanol.
Yes, it is, and actually, it's an argument for MoCRA. Some refinements to MoCRA that could be could.
Very interesting. All right, we'll
There
talk
you go.
about that.
Yep.
All right, so let's just get started. So to start, I want to share with listeners that MoCRA is the first major modernization of US cosmetics law since 1938. And, it kind of represents a seismic shift for brands up and down the food chain, if you will, of all sizes. So, Mark, from your vantage point across multiple disciplines, how significant is MoCRA?
MoCRA is quite significant, primarily for companies that are in the middle market and at the lower end of the market. The large international companies that are selling products in the United States and the EU were already doing everything that MoCRA now mandates,
Hmm,
plus more, because even with MoCRA, the regulation and requirements in the EU are still more stringent than in the United States.
interesting. Okay, so
Yeah,
like the L'Oreals of the world, like the multinational global corporations.
they're already doing everything that MoCRA requires and have been doing everything that MoCRA requires for decades because their most stringent regulatory set is the EU.
Got it.
And if you're complying with the EU regulations, by default, you automatically are complying with the MoCA regulations.
Got it.
Real difference there is in the US, there's now a registration, a mandatory product registration. If you are generating 1 million in revenues cumulative over a 3-year period or more.
That's the marker, right? A
That's
million
the mark.
dollars over 3 years.
Yeah, yeah. $1 million over 3 years. If you have not generated that level of revenue, then you do not have to register your products with the FDA. And there's an FDA registration portal, and it's really quite simple. It's very straightforward to
FDA Direct, is that what it's called?
FDA Direct, yeah.
Yeah. Yep.
So it's very straightforward to register a product. You have to first make sure that your contract manufacturer is registered to be able to register a product. Yeah,
Interesting.
yeah, yeah. And if you are Sally's Kitchen Cosmetics, where you're making it at home, you're not even using a contract manufacturer, and you're
Mhm.
generating less than 1 million a year, million in revenue over that 3-year period, then you don't have to register. You're exempt from registering your products. It's small business exempt.
So that's the below $1 million.
That's below $1 million.
So you're
Now,
just starting out, you haven't made a dime. You don't need to register
you
anything
don't
with
need
the
to
FDA.
register. Yes,
Okay.
correct. Now, you do have to comply with every other component of MoCRA. You
Okay.
just don't need to register your products.
Got it.
And the reason the FDA did that is they cannot monitor, 300,000 kitchens in the United States where people are making products at home, right?
Right. Right.
So they exempted those companies from registration until they're generating some substantial revenues. But if you are self manufacturing in
Mhm.
your garage, let's say, and you are generating more than a million, then you're going to have to get both a facility and a product registration.
Okay.
Go ahead.
I just want to be clear. So the first thing we need to look at is where your product is being manufactured. If it's being manufactured in your own kitchen, you're doing it on your own. You don't really have to worry about complying with registering your product.
Correct.
If you're developing a product through a third party contractor, the product does need to be registered. The formula does need to be registered.
The
Yep.
there are two components to it. The contract manufacturer needs to be registered.
Yep.
Okay. And that's a precursor to being able to register the product.
Got it.
So when you go through the FDA Direct, one of the items of information you have to provide is who is manufacturing the product,
Okay.
right? Who's the contract manufacturer? What is their facility identification number, the FEI number, right?
Okay.
That's
Yep.
what the FDA uses to track the product back to where is it being made, right?
Got it.
If you don't have that, you cannot register the product. You have,
So
yeah,
that number I'm assuming exists in their system. It's probably like a drop down menu, right? You enter it and it's auto populated.
exactly,
Yep.
exactly.
Okay.
There's a separate registration for contract manufacturers. They get issued. The first thing you need to do as a contract manufacturer is get an FEI number.
Hmm.
Once you get an FEI number, you can then register with the FDA.
Okay. All right. So there's that component of it. And
Yeah,
then the next component, I'm just thinking logically through the process.
yeah,
The next component is packaging,
correct.
product labeling. And so what is the MoCRA standard now, and what was the standard until MoCRA?
Well, the standard, the FDA labeling requirements,
Yeah.
the labeling rule in terms of the layout of the ingredient deck has
Okay.
not changed under MoCRA.
Okay.
Descending order of inclusion until you hit 1%.
1%. Yep. And
We're
if
at
you
that
don't know what
1%
that is, go
again.
back and listen to episode 45.
Exactly. When you
Yes.
hit 1%, you can put the ingredients in any order.
Got it. Okay.
The Under MoCRA, I think they're being a little tighter about kind of the front panel.
Mm,
Most products will have a front panel, a middle panel, and a back panel, right?
yeah.
So People typically put their list of ingredients on the back panel. On the front panel, you have to list the product name, the net weight, 1 ounce, etc. And the new requirement that was not part of it, not really part of it before, was you have to list the responsible person on the label. The
Okay,
responsible
right.
person, yeah, the responsible person is generally the brand.
Got
So
it.
you have
Okay.
to have who's the brand. There you go. Who's the brand? What's their website? What's an email address? What is a telephone number for consumers to be able to contact the brand? The big change with MoCRA is now you can put that electronic contact information. Whereas before you had to have a telephone number, it had to be in the yellow pages, listed in the yellow pages.
Mm.
You had to provide a street address. You can still do those things, but now you can just do website, email as your primary contact information.
So you don't need to, as someone who's written packaging copy for years, I've always been meticulous about including that information. Now that company address, etc., does not need to be included. The website URL and an email address are enough.
Yes, correct.
Okay,
Website,
got it.
email. I generally recommend people put website, email, telephone number,
Okay.
but you no longer have to put a physical street address. You no longer have to have a telephone number that's listed in the yellow pages.
Well, that saves some space.
It saves space and it makes it a lot more efficient for consumers who have issues to get in touch with the brand, right?
Right. And what consumer, like, I always wondered, like, who's reaching out to the brand at that address? Like,
Virtually
handwriting a problem, like, of course you would go directly to the website and find the contact page and send an email that way.
correct. Yeah. I don't, it's inconceivable that somebody would send a letter, right? If they've got a complaint.
Here's the address. Let me just
Yes.
write a little note here about how it broke me out.
Well, the nice thing is electronic communication's been available for 25 years now. And, and
The
the
FDA finally caught up. Is that what you're
that
saying?
is why it's called modernization of cosmetics,
Right.
right?
Right.
Modern.
Okay. Yep. Okay. All right. So what else regarding packaging and labeling?
That's pretty much it.
Okay.
Get the information on there for the responsible party so that consumers can get in touch with them. Get your ingredient deck right in accordance with the labeling rules, and your front panel, the name of the product, the net weight or the
Right.
requirements. And then, yeah, they get into, as the font size and stuff like that. So
The requirements, where is that information about the font size?
that's in the FDA labeling on the FDA website under the labeling rules.
Got it. Okay. I mean, I can't even tell you how often that conversation has taken place and working on product packaging with designers and marketing teams. I mean, that conversation's pretty common. Can I
Yeah,
ask you? Yeah, go ahead.
yeah. No, it's just kind of a weird thing that they would dictate the font size. It's
Right,
like,
but I get it because, if the font size, if there isn't a minimum font size,
yeah,
then you're going to go as low as you think you can go to fit copy on a carton. Like
exactly.
I've seen it. So I always appreciate that that's actually mandated.
Yes.
I have a question. What are the implications of a brand not complying with these carton and primary packaging regulations? Like say you leave off the net weight from the front of the carton. What's the
Hmm.
implication of that? Or you leave the ingredient list off. And I have worked on a brand that insisted that they didn't need to put the ingredients on the product, that a consumer can look it up on the website. I'm not even joking.
Yeah, no, that's incorrect.
Right.
The biggest change under MoCRA, quite honestly, is that the FDA has now been granted a mandatory recall authority, whereas
Oh,
before they
okay.
did not have it.
Okay.
So if you don't have an ingredient deck on your packaging, right,
Hmm.
the FDA can mandate that you have to pull all the products off the shelves.
Right.
So the consequences are quite serious, right?
Yeah. And if it's D2C, they would mandate, I'm assuming, that you stop shipping
The
those
correct,
products until you fix
correct.
it. Yeah.
Yes, exactly, exactly. So yeah, it's serious. You really need to pay very close attention to making sure you've got your product packaging properly labeled, or you'd have to suffer the consequences of a recall.
Yeah. Okay. All right. So that's packaging. Is there more on packaging?
No, that's pretty much it on packaging. It's not changed dramatically from the rules before MoCRA. The big change on packaging is now the electronic contact information for the responsible person.
Okay. And then what does the product registration process actually look like? So you're like uploading art to FDA Direct?
No, no. FDA Direct, actually, it's really fairly simple and not that much information is required. So,
Mm.
the first thing you do if you're going to register a product on FDA Direct, you're going to get your contract manufacturer's FEI number.
Mm-hmm. Yeah.
That's a facility establishment identifier number. You get that, and then you enter who's the responsible person, which is the brand, who is the responsible person at the responsible person, that is the individual who is the contact, the main contact for the brand,
Got it.
telephone number, email address. You have to put in the name of the product as it appears on the product label.
Okay.
And then you have to put in the list of ingredients.
Mm-hmm.
You do not.
You have to, like you I would assume would copy that from your PDF file
Exactly.
and paste it. Okay.
Exactly, exactly. So it's exactly the list of ingredients. The FDA does not want to know the percentages, so there's no real proprietary information that you're divulging, and that's pretty much it in terms of a registration. Click go, and it'll take a few minutes, and they'll come back with a product registration number for you, the FDA product registration number for you. So it's really straightforward. It's all information based on who's your contract manufacturer and essentially all of the information on your product label.
Okay. It sounds pretty straightforward and kind of error free. I was going to ask you where errors could take place, and they really can't because you're on the site and you have to fill in this information.
That's exactly right. You can't. And
The
if
error is in not doing it.
Yes, exactly. So if your submission is rejected, it's generally going to be because some information was missing, right?
Mm,
And it'll come back and say, hey, fill in these missing asterisk areas. So it's really kind of foolproof in
okay. Yep.
terms of getting all the information in that is required. So that's
Okay.
straightforward.
Okay.
Now, even though a company can be small business exempt,
Hmm.
meaning you're under the million in revenue over the previous 3 years, if your products are being manufactured by a registered contract manufacturer, being small business exempt does not prevent you from registering your products with the FDA. And
Okay.
and if you want to get onto certain platforms, Amazon, TikTok, etc., they're now asking for that FDA registration information.
Wow.
Okay.
Okay. So you're just starting out. You haven't hit $1 million, but you're going on to Amazon. You need to
It,
register your
you
product.
need, yeah, you're going to need to register for the retailers.
Got it.
So it's a good thing to do to just go ahead and register. It takes all of 15 minutes. It's not difficult.
Hmm.
The
Yep.
companies that are going to have problems, or Sally's Kitchen Cosmetics, who are not using a contract
Contract
manufacturer
manufacturer.
that's registered with the FDA, and they're under a million. How do you then get on Amazon or TikTok or any of the other platforms if the platforms are requiring that product registration?
Right.
You can't, right?
You can't.
You can't.
So what do you
You
do?
go to a contract manufacturer
Oh,
who
okay.
is
And say, look,
registered with
I'm
the FDA.
Sally. Hi, I'm Sally, Mark, and I've made this product in my kitchen and I need you to replicate it.
Exactly. That's
Yeah.
exactly. Yeah.
Yeah. Here's my recipe.
Yeah.
Replicate it.
Otherwise, you'll have to go D2C off your own website if you can't get onto any of the third-party platforms.
Right. Right. Okay. All right. So that's it with packaging. Can we
Yes.
move on to safety substantiation?
Yeah, safety substantiation is another area where the FDA has actually done a good job in
Mm,
terms of requiring proof of safety substantiation.
okay.
So, the components of safety substantiation are a similar to the EU, where you have to produce a product information file. It's called a PIF in the
Okay.
EU.
Yep.
And you also have to have a third party safety assessor write up a report validating the safety or giving an opinion on the safety of the product for human use.
Mm, mm-hmm.
So the safety assessment report, I call it a cosmetic ingredient safety report. Basically, you tap into a toxicology database.
Okay.
And as a professional, and I do these, I provide MoCRA compliance services. You tap into a toxicology database, enter all of the ingredients, enter the full formula, basically the percentages, and then that database is going to provide to you a report with the toxicology and safety profile of each ingredient in the formula.
Wow. Okay.
Yeah. So you then compile that and use some other parameters like what's the pH, form factor, etc., and render a professional opinion that this product will be safe for human use just based on the toxicology profile. The other component of it is doing skin patch testing for
Right. The
irritancy.
HRIPT.
The HRIPT, correct.
Yep.
The
Yep.
HRIPT. So the safeguards in the system are if you want to get onto a third party platform, they're going to require a safety data sheet. They may require an HR. If you ever get audited by the FDA, they're going to want to see your cosmetic ingredient safety report for the toxicology. Make
Okay.
sure that there are ingredients. If an ingredient has an upper limit of use, upper
Right.
inclusion limit, make sure you're not above that upper inclusion limit.
Right. And Sally might be, but a product that's made in a third party manufacturer would not be.
Would not be correct.
Yeah. I mean, if they have experience, they know not to use more than 1% phenoxyethanol or whatever, right?
Exactly, exactly.
Got it.
And that is the major flaw in MoCRA. And that is Sally's Kitchen Cosmetics can be made in her kitchen.
Mhm.
She may or may not know what she's doing. She may or may not be aware of upper limits on the inclusion of some ingredients.
Mhm.
So that's the area of the industry where you're most likely to have non-compliance issues. And
Got it.
what the FDA has done with MoCRA is said, okay, all of those little people, we're going to kind of give them a pass, right? In terms of trying to regulate them to make sure that they're complying with the regulations and that their products are safe.
Mhm.
And then that comes down to a consumer issue where one safeguard may be the third party retailers saying, if you want to get on our platform, we want to see this documentation to make
Oh,
sure your product, yeah, to make sure your products are safe. If Sally's going strictly D2C, then you know you're kind of taking a risk as a consumer
right.
assuming that that product is safe.
Yeah.
So the way it's set up, and I think this is going to happen over time, is that the big retailers are going to be the gatekeepers of MoCRA enforcement.
Mhm.
You want to get on Amazon, you got to provide all the documentation. They want to make sure that you're MoCRA compliant.
Yeah. They kind of are the gatekeepers by
Correct.
default
By default,
already.
yeah, by default, they're the gatekeepers because they don't want to get involved in the distribution of products that don't have a proven safety profile. Why would they do that? They
Yeah.
have no incentive to do that.
Yeah.
So that's the mandate for those safety substantiation was something that was kind of assumed or presumed before MoCRA, and it got codified in MoCRA.
Got it.
Got
All
it?
right, let's move on to serious adverse events
Yes.
or SAEs. So
Yeah.
first, define and maybe give an example of what constitutes an SAE.
Yeah. Serious adverse events or quite serious reactions to use of a product that require medical attention.
Okay.
And that can go into death, burns, very serious skin reactions that do require medical attention to resolve.
And these are situations that arise, and presumably a consumer reaches out and says, "This happened to me." That incident needs to be reported by the brand to via
Correct.
MoCRA through MoCRA requirements.
Yeah. So this is how the packaging requirements, the
Mm,
labeling requirements of putting the responsible person on the product
yeah.
label,
Yep.
and the safety substantiation requirements all dovetail, right? So if I'm a consumer, I buy a product, I use it, and I get second-degree burns on my face, right?
Mm-hmm.
I have to go seek medical attention. I get the medical attention. I then contact the company using the responsible person contact information on the container.
Mm-hmm.
Contact them and tell them, hey, this is what happened to me. Okay. I had a serious adverse event. I had to go to the doctor. I got burned. The company is now responsible for doing the intake of the required information to assess the situation.
Mm-hmm.
There's a Form 3500A that is used for the pharmaceutical industry that
Okay.
has been adopted for use by on the cosmetic side under MoCRA.
Interesting. Okay.
Yeah, so I'm the company representative,
Mm-hmm.
and I'm getting this report from you as a consumer. I'm going through and filling out the Form A, collecting all the information, trying to get access to medical records, etc. Okay. If it's a serious adverse event, like a burn, then the brand needs to report that to the FDA within 15 days of being notified by the consumer. So it's a
Okay.
pretty quick turn, right?
Yeah. Because it could be something like a batch contamination, right?
Correct. Yes,
Where they
exactly.
might need to issue a recall on a product. Yeah.
Exactly. So
Yep.
the FDA will then get involved and do an audit to try and figure out, is it a batch problem?
Mm-hmm.
Is it a cross reaction of that product with another product that the consumer was layering on, right? What are the medical implications? How many times has this happened? Are we seeing an inordinate number of incidences with this particular product? So maybe it needs to be reformulated. Maybe the glycolic acid in is at 14% when the upper level is 10%, right? So they'll get down
Or
to the
you're told to leave it on overnight in the packaging instructions, and you wake up
exactly.
with burns on your
You wake
face.
up with burns.
Yeah.
So those will be investigated quite thoroughly. And then, of
Hmm.
course, there are legal implications, right?
Right.
Your product burned a consumer. Part of the difficulty is, kind of really understanding, is it the product itself? Is it a cross reaction with other products that the client is using? So you need to
Right.
sort
Yep.
that out. So if that's the case, you may need to end up reformulating, but you can bet that a thorough audit will be done. Okay. Now, the other component of adverse event reporting is just an adverse event. So, an adverse event is I go to the store, I buy a product, I apply it, and I've got a welt, and that welt persists for 12 hours. right? And then it dissipates, and there's no requirement per se for medical attention. I might go to a doctor, but it's not something serious enough. There might be persistent irritation, redness, itching, that type of stuff. In that instance, same process. The company gets notified by the consumer. They fill out a 3,500 document, the adverse event. If there was no medical attention needed or administered, then you keep that in your files for 6 years if you're not small business exempt, 2 years if you are small business exempt. There's no reporting to the FDA. So
Got it.
in that kind of instance, someone could have just had an allergic reaction. You cannot make a cosmetic product where someone somewhere is not going to react to it. Some
Sure.
subset of people are always going to have an irritants reaction, maybe an allergic reaction. So you document it and keep the records. The company should be monitoring, are you getting more than 1% adverse event reports to a product? Not serious adverse events, but adverse events. So maybe you're having some issues with something in the formula causing irritation or allergy, but not really any serious consequences. But if you monitor that and see that you're, let's say, greater than 1% of your consumers are having some kind of reaction, you really need to go back and take a look at that formula and try and figure out why.
So take as an example a sunscreen. Those are not, so if a consumer gets a burn, she's applied a facial sunscreen in the morning and she goes about her day and it's a particularly sunny day, I don't know, in July, and she's realizing at the end of the day that she has a sunburn, and she reports this to the brand. I used your sunscreen today and I have sunburn on my
Yeah,
face, and the packaging says it's an SPF 30. That's an adverse event, but not a severe
correct. Correct.
one, right?
Yeah,
But then the brand could be accumulating a few of these and then presumably discover that, like in Sunscreen Gate that's been going on for a few
yes,
weeks
correct.
now, that, maybe their product SPF is not correct.
Exactly. Same thing. So they should
Yeah.
go back and retest it, confirm their SPF rating,
Yeah.
maybe even use a different lab to determine the SPF
Right.
rating, and just make sure that their rating is correct. But that would be just a regular adverse event, not
Yep.
a serious adverse
Severe.
event.
Yes.
Yes,
Unless,
exactly.
yeah, unless she went to the beach, like, but even then, she
Yeah,
just didn't apply it. Maybe didn't apply enough. Who knows?
it could be that she didn't apply enough. I mean, there are
Yeah.
all kinds of
Or
factors.
washed it off.
Yeah, yeah, there are
Sunscreen
all
is so
kinds.
complex.
Yeah, because you never know. You can always give consumers directions,
Yeah. Are
but
they
you can't
following the
control them
directions?
following exactly. You
Did you
cannot.
reapply every 2 hours? It does say that on the back of that
It says
carton.
that on the packaging. Yeah, but you have no control whether they do that or not.
Yeah, I know I'm guilty. I don't do it.
I had, and then you have clients, consumers who are just trying to get their money back after they used half the bottle.
Right.
That happens.
I'm sure it does. I'm sure it does.
I had a client for whom I developed a hyaluronic acid serum. So it's just,
Okay.
multiple molecular weights of hyaluronic acid, which
Yes.
is
Don't tell
native
me
to the skin.
someone complained that they were dehydrated. Please don't tell me that.
Someone complained that they had been burned by the
Oh,
hyaluronic. Oh, yes, they had been burned by the
what?
hyaluronic
Not a
acid.
hyaluronic acid burn.
Yes, yeah, it's like, it says acid.
Were you thinking you'd heard it all?
Just when you think you've heard everything, and it's like, well, wait,
I
hyaluronic
got
acid is
hyaluronic
native to the.
acid burn. My
So,
God.
hey, look, on the brand side, you get all kinds of
Yes,
complaints,
for sure.
all the time.
Yeah.
So that's part of, on the adverse event side, right? Not the serious stuff, but just the
Yeah.
adverse event side. You need to make a determination as a brand, is this a real problem with the product where people are having irritancy reactions, or it some component of it, consumers complaining after they've used half the bottle to get their money back, right?
Yeah. Yeah.
So you just have to probe and work
Par
with
for
the
the course.
consumers. Yes.
Yeah. All right. So is there anything regarding MoCRA regulations that we've missed?
Well, we'll just kind of run down the line here. Yes, actually, for companies that are based outside of the United States
Hmm.
who are selling cosmetic product in the United States, they are required to get a US agent to represent them with the FDA. So if,
Okay.
let's say, there's a company in Switzerland, right?
Hmm.
And they are now selling into the United States, they need to engage a US agent who will be their contact point person if there are issues with the FDA, and the US agent can get their products registered, etc. I'm in the middle of doing that for a company right now out of who are going to be bringing products into the United States and need to go through the process to make sure they're fully MoCRA compliant.
Oh, great. I mean, I was going to ask you, how do they go about finding an agent? And I guess they would simply reach out to you at Desert and Bloom Cosmetics Lab.
That's correct. That's
Yes.
correct.
There you go.
That's how you find an agent.
That's how you find an agent, people. You call Mark Broussard
You
after
got it.
listening to this podcast. Actually, if you're listening to this podcast, just go to the show notes and click the link and you'll find Mark.
Yes, correct.
It's
Correct.
that easy.
Yeah, and this is a side story. In our first podcast, I told you I was a fashion runway photographer for a while.
Yes. Yes. Has something changed?
Well, no, but this is, kind of how life links back in.
Yes. Yes.
The brand coming into the United States is the brand from a very famous fashion designer in England.
Hmm.
And when the brand contacted me, I said, "Oh, cool, I'm very familiar with the brand." And I actually met the designer at a party, and it was like kind of going to an Alice in Wonderland tea party. So after her show, these two guys walk up to me, and I was a photographer. I was a pit photographer at the show. These two guys walk up to me and hand me an invitation, and they're kind of both dressed like the Mad Hatter, just this really wild clothing. So I said, "Well, hell, of course I'm going to go to the party," and then went and got to meet the designer and kind of spend some time at the party. So it's just one of those things of life circling around under completely different circumstances. But yes, contact me and I can help you with MoCA registration.
All right, perfect. I just have two more
Yeah,
questions,
sure.
and then we'll do my fun signature lightning round. So, regulatory shifts often affect innovation speed, formula decisions, operations, all of that. Have you seen or do you foresee MoCRA slowing down the product development process?
No, not really. The way I now do product development
Hmm.
under MoCRA is the first thing I do is the MoCRA compliance work to make sure before I actually start formulating. I do everything on paper, obviously, to make sure that what I'm developing is MoCRA compliant, and checking, am I above the limits on any ingredients or anything of that nature.
Right.
Now I'm very comfortable moving forward formulating. So it's a step that you're going to have to do anyhow
You build it into
under
the
MoCRA.
process.
You might
Yeah,
as well do it up front before you start formulating, as opposed to on the back end and find out, you might have to reformulate. So
got
no,
it.
it won't slow anything down. I don't think so.
Okay. All right. And then the last question, like some components of MoCRA, like fragrance allergen disclosure, are still rolling out, right?
Yes, correct.
So,
Correct.
like, can you quickly go into what that requirement is and why that's important?
Yeah, the fragrance allergen requirement is what, 3 years late now?
Hmm. Right.
Right. So I have a hard time understanding why that's the case. After MoCRA was passed, the EU expanded its reportable fragrance allergen list to 82. From, I think they were at like 25, 26. Now it's 82 reportable fragrance allergens. In the US, they have not implemented the fragrance allergen component of MoCRA. I don't know why they're delaying, because the state of California has preempted the FDA
Mm.
and has adopted the 82 EU fragrance allergens that need to be listed. So if you're going to sell in the United States and you're going to sell in California, and the California Safe Cosmetics program is quite diligent about going after companies, making them register with the state of California. In doing so, you have to comply with the EU fragrance allergen requirements in terms of
Right.
listing, right?
Right.
So it would seem easy enough for the FDA to just say, we'll have a harmonized system and we'll adopt the same rules on reporting fragrance allergens as the EU. And now you're done, right? So the best thing for companies to do is just go ahead and move forward on listing the fragrance allergens following the EU framework and now the California framework. And don't worry about whenever the FDA is going to come up with its own list, right?
And what does that action look like? Simply so there's 82. The EU's has defined 82 fragrance ingredients.
Yes.
I
Fragrance
don't know.
component.
Yep, fragrance components that are potential allergens. I don't know. Is linalool an
Yep.
allergen?
Yep. When
Right?
you
And so that needs to be listed in the ingredient list as an
correct.
ingredient. Why
Correct.
wouldn't that have been listed in the ingredient list before?
Well,
There's a generic line that says fragrance.
yes, you can put in
Okay, or
fragrance,
parfum, right? Now you
parfum,
have to actually
fragrance.
list all of those
Now you have to put a fragrance or perfume, and then at the end,
because they're a
lemony.
tiny component of that fragrance,
Correct,
like,
correct.
right?
So if
Mhm.
it's linalool, limonene,
Yep,
all the various allergens, you have to list them out in your ingredient deck, right?
right. Or remove them, right?
Or remove them, don't put a fragrance, or if you're custom formulating a fragrance, it's really hard to get something that would smell, nice, right? That would be appealing without including any of those fragrance allergens. So,
Right, got it.
linalool, limonene, they're in virtually everything.
They're always at the bottom of that ingredient list. Unless
Exactly.
the product's fragrance free, and if you're using a facial skincare product, it should be fragrance free.
Correct. Correct. Yeah.
Yeah. As Paula Bagoon of Paula's Choice used to say, and probably still says, skincare isn't fragrance.
Correct. Correct. I mostly develop unfragrant
Yeah.
products, not even
Yeah.
essential oils because of phototoxicity, allergenicity, etc.
Right. Yeah.
It's just, yeah, they smell good, but do you really want to put that on your face, right?
Right. Right. And risk consumer safety.
Yeah, it's a component that increases your risk of adverse events, right?
Yeah. Yeah, for sure.
Yeah.
All right, let's do a quick lightning round and then we'll wrap. Something you believed early in your career that you no longer believe.
I started off in the natural arena, so I no
Hmm.
longer believe natural only works. Yeah.
Okay.
Yeah.
Yeah. Good. I'm with you on that. That's
Yes.
great. All right. An ingredient you'd love to see more brands experiment with in 2026.
Povita from Core Biogenesis.
Oh my God.
That stuff is amazing.
What is it?
It is a growth factors fused to an oleosome, and the oleosome
So they
is
penetrate.
they penetrate. Yes, yes.
Okay, great. Awesome.
That to me is, and actually they just won a L'Oreal award. in a kind of competition, technology competition.
Okay.
And it's just got really great, amazing results.
That's
So,
awesome.
yeah, yeah.
All right, we'll
And
be on the lookout for that.
correct, yes. That's a really hot up and coming ingredient.
And you're formulating with it?
I've been formulating with it ever since it came out.
Okay, good. So when we're done recording, I'm going to make you give me some product recommendations.
I'll send
A
you a
signature
serum.
Mark Broussard product.
I'll send you this serum contains it.
Oh my God. All right, I'm going to drop my address.
Give me
No,
your address
I'll
and I'll,
give you your, yes.
I'll send some to
Awesome.
you. Yeah.
All right, and the converse, a beauty trend you hope doesn't survive 2025.
God, there's a whole bunch of those. I think some of these things, like, well, let's call them beauty trends.
Hmm.
Slugging, people putting
Okay.
Vaseline, smearing Vaseline all over their face.
Yes.
Those kinds of things, I look at them and it's just like, this is just weird. Why would you
What
do
are
that?
you doing? This isn't
Yeah, what are you doing this for?
1965. We've come a long
Yeah.
way.
And slugging may no longer be a thing, but those kinds of, TikTok fixes that
Right.
just don't make any sense.
The beef tallow thing, maybe the beef tallow is another
Beef
one.
tallow, yeah, that would be another
Yes.
one. So
We need to go
slugging,
back
beef
to just
tallow.
eating our beef tallow, not putting it on our faces.
Exactly, yes.
Okay, perfect. Next, an inventor, founder, or scientist that you admire.
Well, there are several of those.
Mm,
I would say Alexandre Reber of Core Biogenesis. I
mm-hmm.
think has come up with some really great technology. Was it Joshua Brighton at Debut? I really like what they're doing in terms of finding new ingredients using AI and then incorporating them into their own products. Those are I'd say, the two most innovative people I've seen out in the market recently that are really just coming up with some great new ingredients that are very effective.
Super cool. All right, last question. Finish this sentence. The right regulations lead to.
More safe products, better outcomes for people to use these products.
Awesome. This was perfect, Mark. Thank you so much. We
Hey,
have
thank
broken
you.
down MoCRA. Hopefully, it's very clear and not so scary. I
No,
went into this thinking it was a little scary, but it's not.
yeah, no. And when it first came out, a lot of people were, it was kind of all over the place, people talking about it and being concerned about it. But
Yeah,
MoCRA regulations are very common sense. They really don't put a burden on brands. And even without MoCRA, it's what you should have been doing anyhow, right?
right.
So
Yeah,
good for
yeah.
brands, good for the industry, good for consumers.
Amazing. All right, and again, I'll drop your contact information into the show notes if people want to reach out to Mark to find their leader in this arena. He's the man. Thank you,
Perfect. Thank
Mark.
you. And I need your address, remember.
I will. I'll send it
Okay.
to you.
Sounds
All right.
great. Thanks, Carmine.
Ciao.
Bye bye.
All right. Thank you for listening to the Skin Karma Pod. Find more insights, real talk, and reviews of my favorite skincare products on the Skin Karma blog at skinkarma.com. And if you're listening on Apple Podcasts or Spotify, please rate and review this episode. It helps me to reach more listeners. Ciao.